Everybody, and welcome to the broadcast today. Welcome and Happy New Year. It's 2018. A lot of the fourth quarter business has been done, so hopefully we can all just take a breath and regroup. This morning's broadcast is going to be very informative. There's a lot of information we're going to talk about today because the beauty is we want to be able to make sure that now that we have some time, because again, now we're going into our non-busy season. The important thing to do now is to get better. And so that way you can, the goal today is to really make sure we save you time and money within your agencies. We're going to talk today how to increase efficiencies within your agencies and free up internal capacity. So that way you can really focus on the things you need to do. And if you need to find resources, we're going to actually show you where to access those and really save you an enormous amount of time. So as we talk about what we're going to do today, there's three things we're going to accomplish. We're going to go through some resources. We're going to talk about the advantages of using Beere&Purves, and we're going to go through the 2018 carrier highlights. All the information today is going to be sent to you this evening, so you'll have it all, so don't worry about scrambling to take notes. But we're going to show you a lot of tools today that I think you'll be very happy with. So a couple of things. First of all, eCentral. eCentral, we do have a specialist here in-house and volume of groups here at Beere&Purves that went to eCentral in 2017. And it was interesting how technology obviously is something that we're all being made more aware of. A lot of companies have done an enormous amount of effort to put together technology in our industry. But what we found is that for eCentral, 8% of the groups that we wrote in 2017 went onto an eCentral platform. Now, again, our average size group is under 10 lives, so maybe that is one of the reasons as to why. But a lot of the talk is focusing on pushing technology, and technology is here to stay. That's no doubt. It increases the efficiency. But it's interesting how at this point in our business, we're finding that only 8% of the groups that we wrote in 2017 use the eCentral platform. So just want to give you a little bit of information on that. So I do think service is going to be the overwhelming, compelling reason why groups are going to be staying or moving to different brokers. We have a dedicated sales support specialist team. We have two people in our office. That is Heather Lewis and Tracy. So we have dedicated quoting support that's available to you. And just to back up on that eCentral specialist, we have a gentleman named Ryan. So as soon as a group is sold, if they want to go to eCentral, within 24 to 48 hours, as long as we have the group plans, we can load that up in the system. We can be added as a guest to your existing eCentral account, or you can use ours at no cost. And for those of you that do have an eCentral account, what we do is we give you $1.40 per head per month times 12. So what that does, it helps offset your costs. And again, one of our goals today is to figure out how to increase your profitability as an agency. That will actually reduce your eCentral expenses. And for those of you that already have an account or get it elsewhere, it'll free up and give you a credit for eCentral. So if you need to put together 1095Cs for groups, now you have money to access. And if you have any questions on that, let me know. But that is something I want to make sure everyone's aware of. And please utilize that. It'll make you more profitable here in 2018. The enrollment support team. We have online enrollment specialists as well as myself. I'm happy to go out and do an enrollment anytime you need it. We also have access to interpreters that can provide any language that's needed as well. And those are also included at no cost. Now we're going to focus on some of the resources. Now the first one we're going to talk about is network and RX searches. We had a group in this example, and the broker was trying to figure out if we moved them from an existing carrier to a new one, how would this work to make sure that the providers are included onto the new carrier that we moved on to. So in this example, you'll notice that the providers are listed. These are the owners of the group and their providers. It's everyone in each of the carriers that you're seeing there. And this report is available to each and every one of you to provide this information. So that way, when you go back to your group, they're telling you exactly the providers, the medical groups, hospitals, clinics, pharmacies, and treatment facilities in some cases that they need to see depending on the health and issues going on within their family. Now we can come back with you with a very comprehensive report. So there's no reason somebody could move from carrier A to carrier B and not know that that provider is not in network. So when you look at this tool here, you'll notice that Aetna, for example, only one of the providers is not in the network. Anthem, a lot of the providers are not in the network. So even though in this example, if Anthem has a lower rate, we may want to go with Aetna because the providers are there. And this is the tool that we have available. We have a dedicated resource. His name is Patrick Kim that runs these reports. And this is the consistent form that you can get back and to make sure that there's no issues when you move a group from carrier A to carrier B. This is also done with pharmacy. So whenever you have the owner or the owner's family that have medications that they're really focused on maintaining within the formulary, let us know. We can actually outline in a similar report and tell you which tier 1, tier 2, or tier 3 that medication is located in, so that way they can really make an informed decision. This is something that I don't think any other GA offers, and I want to make sure that you take advantage of it because it's a tremendous resource when you're selling to your groups. The other thing I want to talk about is once a group Shield, and now we're going to United Healthcare. Once that group is approved, we send you a group approval letter. And that approval letter is going to look like this. And the way this works is I'm going to get, if you have a new, you can either new hire information is, or the information here on the approval letter takes you through how to do dependents and benefits. And all of the employees really know if you can possibly. This information is done at the enrollment meeting before the group at initial enrollment, so they understand to go ahead and get their medications topped off. Oftentimes run into a fire drill. They're going to be, you can have a doctor go to your home, and you can do everything else online. So it's really amazing the technology that's available, but unfortunately a lot of this is not explained at the enrollment meeting. So I want to make sure everyone does have a clear understanding of how this works. You don't pay based on this, can be effective date, and some of the other tools we want to share with you when we go to the back pocket. Let's say the installation. So as you come down here, some of the things that we had a broker who got in trouble, get the cards there, the employer. In this case, because details are asked us, we would have told them, unfortunately, you cannot send the ID cards to the employer. They have to go to the employees. So these are things that you want to make sure that you remember where these tools are, because they can really save you a lot of grief. And in that example, that would have been a good key one to avoid. Also, the number of ID cards, they're all listed here. So this is a good tool to remember. So when we talk about billing, does it do? Where does it go? What about late cancellations and notices? Is there a billing? If I have a statement, what's the phone number? All of the we want to generate a medical comparison. Our survey that we're looking at Anthem Blue Cross and we're looking at United Health. So what are the rules regarding owner only? And we click the carrier and we click generate details. You'll notice immediately the owners can be written if they're a C Corp or an LLC, and UHC enrolling, or can they just be eligible? Well, as long as I have, if I have owners in this example, we could do, as long as that one is eligible, we can go ahead and enroll. So these are some great tools that you can really make your life easy by clicking on the carriers, clicking on the specific category. And the last one I want to share with you. So they have employees that are in Alameda trying to figure out, should we put them in the, which is the full M, which is going to be, so it means it is in the network. So if I have a specific hospital that I need access to and put that charge without spending all individually on our website. And if you have any questions on any of this, please let us know, and we're happy to walk through this with you. Underwriting, we have underwriters in-house, which is unique from other GAs. We're here located in Walnut Creek. We have 3 full-time underwriters. As soon as a group comes in, it's first in, first out. If you have a preferred underwriter you like, we can go ahead and have that one assigned to you. The beauty is we want to make sure that that group gets approved. So we can have a conversation as to what is the information, like a social security number off a DE9. And that's something we take great pride in, is not having to go back for things that we can figure out ourselves. The billing and claim issues, these are critical to make sure that your group is happy. We have Randy Halsey in our office here. Anytime you have a group where you get a no on a billing or claim issues on a quarterly basis with their senior management team, we are very fortunate to have a higher track record of success getting special exceptions, which makes your groups happy. So that's it. Custom generators. This is another thing that a lot of folks may not be aware of. We talked about the say, I need a group that has, and in this example, we're going to be looking at the Bay Area, and I'm looking at, we'll do a network immediately. These to go to a specific, want to go with the UAD. The other one is competitive plans by county. And as we're going into 2018, we want every quarter in that quarter, when you're doing your quotes, and actually we can access it a couple of different ways. So the network comparison is here. Actually, let me close out of this. When we look over here, you see where it says rate stuff. Plans are the most competitive you're looking at. You should be, but if they're not, then there should be an opportunity. Happy, a lot of the groups, especially the most competitive plans by county, by 19 rating regions in the state of California are here. If you have a question as to where the employer is located. So now we're going to move on. Now we're going to talk about some of the advantages. As I mentioned, we are here in Walnut Creek, and I would encourage each and every one of you on the phone to please come by and visit the team that's here to support you. I think it's important for you whenever you place a group this year, you're welcome to come in anytime. We have a lot of paper enrollment materials here that we can either email or send to you electronically, or package into enrollment kits and send to you or to the group directly. Legislation is the second thing I want to talk about, and this is extremely important. You'll notice that if, and when I'm looking at this, this is going to actually have the 60-55 and 60-56. And for those of you that may not be familiar, the 60-55, those are for groups that are with employers with under 50 full-time equivalents. And they are reported by the insurance company. So the insurance company sends that way, it indicates if that employee has medical coverage or not. The big one is for groups that you have the 60-55, which are called the 1090. There are penalties involved with this. If you're going to be sending a paper copy, the deadline is February 28th. If you're doing it electronically, you have till April 2nd. We're in the process of updating this because these were recently extended outward. But this is important, and as your broker and if you're prospecting, you want to make sure you're familiar with how this works, and because a lot of brokers are not providing much assistance in help dollars per return for failing to file this on a timely basis. So this is something you want to be looking at as a tool in your arsenal of employers. We currently have a special relationship with two vendors, Sterling and Task, and so if you do need to get these reports done, let us know. We have preferred pricing, and we can pass that along to you to get that taken care of for you. The other thing I wanted to mention are under 10. So this really comes into play because it's 1 to 19 employees. And as we come down through here, I want to make sure you're familiar with these. As you know, this is within 90, that as you're going through this, there could be a penalty that you're these notices, because these are required for employers with groups 1 to 19. And who does it, who's it provided to, and when is it due? So as you now have a chance to do some cleanup, these are items you want to be paying attention to. There's a health insurance exchange notice that must be given to all employees within 14 days of their start date. There is a summary of benefits SBC that's required within 90 days of a special enrollment. Are Medicare Part D compliant? But you'll notice as we go down to the bronze plan, some of these, the bronze plans by not having a creditable plan. And groups on a going forward basis, making sure that there's no issues associated with that as well. Anthem EDI feeds is something that we are very fortunate to have access to. So when a group comes to us, they're switching from, let's say, Blue Shield over to Anthem. As soon as we have the group, we can get it. If we get it in the morning, we'll send it to Anthem electronically. We'll have group numbers and individual ID numbers potentially in the same day. So that is something that is a nice enhancement. We also have downloads that you can get from our website. So if you need help with that, please let us know. The SBCs are as a click of a button. And then we have the back office support, as I mentioned. So anytime you send us an add, delete, or claim resolution, we'll send you a confirmation that we received it. And then once the solution is done, we send you a confirmation that that employee was added or termed. So that way you have confirmation and know that it was handled properly. The other thing that I want to do now is have situations that do come up. To rate the full and the narrow, that's going to be allowed through 3. Please keep that in mind as well. The other thing is 6 enrolled. All you need is a prior carrier bill in lieu of the DE9C. That was through 12/1/15. So that one we're double checking to see if that is going forward or not. We'll have that updated very shortly. 5 or more, though, it's 30% participation. This is very helpful, by the way. Anytime you have groups that we had a broker that had a situation where they had enrollment in California and groups that were employees that are outside in Nevada, they wrote all of the Nevada employees onto the Anthem plan and all the California employees onto the Kaiser plan. And what they did was, as long as they had 30% participation and they had 51% eligible in California, they were able to write the plan. So that is something that is not a lot of brokers are aware of. So please take that into consideration should you need it. Individual coverage, again, a valid waiver, which is nice. So that way it's easy to make participation. And finally, startup groups. We are starting to see in this new economy, a lot of new groups are coming into play. Anthem is your best friend from a startup group standpoint. The payroll and the coverage can start on the same date, for example, on a 2/1 date. As long as that group is showing up on the business portal as active and eligible to do business in the state of California prior to that effective date, you can go ahead and have them start the group. As long as we give them 30 days of payroll within 45 days of the effective date, your startup group is all set. Cal Choice is going to be a big winner here in 2018, and here is why. The Kaiser rates and the benefits are exactly the same as they are going direct. So if I am a company and I'm going to go ahead and provide Kaiser rates, I will offer California Choice. I'm also going to be offering the Canopy network that we're going to be talking about through Western Health Advantage, and Sutter's available and Anthem's available. So in 2018, if I'm an employer, I'm able to provide the maximum flexibility, offering a Kaiser plan at the same rates going direct. So that's something to keep in mind in 2018. HealthNet had a rate pass, which is good. Unfortunately, HealthNet has struggled a little bit over the last couple of years, but having a rate pass only helps them. And then the rates went down for their HMO. And lastly is United Healthcare. United Healthcare continues to have that participation form, which makes it very easy. Instead of a DE9C, as long as you have 10 or more enrolled, you sign the participation form and you're done. Alongside a Kaiser, all you need is a minimum 5. So we had a group of 90. We had 5 of the owners go to UHC. We had the other 85 go to Kaiser, and that's easy way to do it. If you have groups that are out of state, UHC is your best option. So let us know if you have any issues with that one. And then the individual exchange is valid. The other thing I wanted to mention to you is if it's a 1 to 2 life group, it's going to take a lot longer for underwriting. UHC is really scrutinizing these 1 to 2 life groups, so you want to make sure you manage expectations at the employer level and let them know they're going to be. It's not going to be as fast as groups 3 or more. Now let's talk ancillary. You just went through and looked at all of your medical groups. 70% of the medical groups in our situation renewed or in the between 12/1 and 1/1. That's when the vast majority of them come up for renewal. And what's interesting this year is that because a lot of the groups had single-digit rate increases, they just decided to stay put with their medical plan, which allowed brokers to focus on ancillary for the first time in a long time. Oftentimes, the ancillary is really not given the recognition or the attention it deserves. So now is a perfect time to really focus on ancillary. As we're looking for ways to grow revenue in 2018, ancillary is a great way to do it. The rates are becoming more competitive, and the options are vast, as you see here. So Anthem doesn't require the DE9C, and they have some great plans, 80-90% UCR. So we want to make sure you're aware of that. And ortho is 5 eligible and 5 enrolled. That's a very low orthodontia threshold that a lot of the other carriers do not have. And they also order discounts. So if you have the dental, they'll give you the 5% discount with the vision and the life. Choice Builder has been a great surprise for us in a very positive way. Because of their ability to have Delta Dental, VSP, and Met, and no DE9C, they're our #2 ancillary carrier. So I would encourage you, every single renewal that comes up, always offer the ancillary lines, because now with the economy doing better, there's more money available for the employer to be spending on these ancillary benefits, which are going to be more profitable to your agency. Delta Dental, there was a rate pass, so they haven't had a rate increase since 2014, which is excellent. Guardian is there, and if you need implants for 2 or more, Guardian's a great solution for you. And they have rollover. MetLife, anytime you have groups 10 to 19, they do the 5% discount. And then with UHC, oftentimes brokers don't give credit to the ancillary lines of existing medical plans. What we've seen a new trend developing, though, is if I'm a group of 6, it makes a lot of sense for me as the employee to package it all with the medical carrier. For example, I'll go ahead and either package it with Anthem or United, whoever's got the best rates for the medical, and put it all together. So that way the medical, dental, vision, life is all with the medical carrier for all the ancillary lines. For the smaller groups, it doesn't make sense to go ahead and have an employer of 6 filling out multiple applications. What we found is the savings are not there, and the administrative ease is definitely worth it. So I would encourage you to take a look at that as well in 2018 as you're dealing with the smaller size groups. Putting it all together makes a lot of sense. Principal is the other carrier that we have access to, and they also do an excellent job, and they can do dental, vision, life, LTD, and STD. And then we have VSP. We have the same rates as going direct. The one thing I want to make sure everyone is aware of, though, is if the group currently has VSP in place, and if you come to us and they're really sensitive to pool hopping, so if they're on another chassis with VSP and you come to us and try to write them, we cannot get involved. We would just send those on directly to VSP. So I just want to make sure you're aware of that. But the rates are the same. Now let's talk about Canopy. Canopy is something you heard a little bit about in 2018 or 2017, but it's important for you to be very familiar with this, because this is going to be something that's going to make you money in 2018. And the reason I say that is because this was developed in order to stop the slide of business to Kaiser. It is a very low price point, and so the reason this is very competitive is because there's a group of doctors, these are the Canopy physicians, that have been doing a great job of providing medical care for a number of years. And every time they've done it, the insurance company wins because they're the ones who are saving the money. So these group of doctors, about 4,000 of them, decided to get together, form a medical group, and contract with the carriers directly and have a lower price point to start with, which allows them to compete in many cases with Kaiser. And then if there is profit, they get the windfall on the back end. So so this is something you want to become, again, familiar with. The network is unbelievable. The 2 premier medical facilities here in Northern California are UCSF and Stanford. Going through Canopy Health, you have access to UCSF at a very low discounted price. Living here in the East Bay, I like John Muir, so I can sign up for Canopy, pay a low monthly premium, see my John Muir doctors. If anything is catastrophic that goes on with me, I'm going to go to UCSF, and now I have access to that. And I paid a lot low base premium than a lot of the other folks who've gone to other carriers who are trying to access the same network and facilities. So the way this works, the member will select a John Muir Medical Group, PCP in Walnut Creek, and that way they can be referred to UCSF in San Francisco. The members are going to get the mobile cost estimator, and it's going to allow them to understand exactly what that is going to be. The carriers you're going to be quoting are United Healthcare, the Signature Value Advantage HMO network. Now, here's what happens in most cases. You have Kaiser alongside a UHC. When you ask your quoting team to quote that, they're going to quote the UHC PPO plans. They're not going to bring up the narrow HMO network, which is what the Signature Value Advantage is. So it's important for you to educate them on when we quote UHC alongside of Kaiser Direct, I want you to also include the Signature Value Advantage network. That is going to have a much lower price point than the PPO plan. And it gives me as the employee the ability to save money, because in the past, I've always just gone to Kaiser because I couldn't afford the UHC PPO. Now I've got a middle tier step. I can go to the Signature Value Advantage, and I can also look at the PPO options. So this will actually allow more employees to have UHC, to access UCSF, and you as the employee, as the broker, will make more money, but you're also doing a nice service for your employees, giving them an option. The other way to access this is through Western Health Advantage. So again, Western Health is in Sacramento. They're a full network. As they come through Solano, that Western Health Advantage is coupled with the Canopy network for here in the Bay Area. Now, we have access also to Western Health Advantage through CalChoice, which is how a lot of brokers are doing it now. When you ask for a UHC or a California Choice quote, again, the Kaiser rates are exactly the same. You can have Canopy through Western Health Advantage, giving them an option as well. So this is why this becomes a very solid solution. The only disadvantage is, and we want to be very transparent with this, is the adjacent metallic tier rule is still in effect. So what that means is that I can only quote bronze, silver, silver, gold, gold, platinum. So with CalChoice, you will have that limitation. If the employer wants to go ahead and quote the bronze employees on Kaiser, then you can go to United Healthcare and go quote the signature value advantage and then quote the PPO if the adjacent metallic tiers are a limitation that the employer cannot overcome. So in summary, the member gets to save the money and they get greater access to providers. This is an HMO on steroids. This is an unbelievable opportunity now. Once the employees understand it, they will see the price savings, and we do anticipate a lot of migration to Canopy in 2018. The next thing you're going to hear about are the 2018 medical updates. And again, last year, if I had children between 0 and 20 years of age, the rate was exactly the same for every child 0 to 20. And the way you want to think of this is, if my 21-year-old rate is $100, my 0 to 20-year-old rate was $63 for every single kid between 0 and 20 in 2017. Now what's going to happen is a massive shift is happening in 2018, and the rates are going to go up significantly, and the poor families are not going to understand what happened. So you need to be able to explain this to them so that way they understand. Last year, if I go from a 20-year-old to a 21-year-old, the rates go from $63 to $100 for in that example. That is a massive increase, and the state of California decided to go ahead and not have that big jump between a 20 and 21-year-old and basically stair-step it, so that way that jump was not as big. But here's what happened, which actually made it worse. So if I have a child in 2018 between 0 and 14 years of age, last year that child was $63. This year they're going to be $74. So the base rate, not only for the 0 to 14-year-old, that went up 20%. So I, as a family with 3 kids, I'm going to be in a situation where my 0 to 14-year-old just got a 20% bump between 2017 and 2018. It only gets worse for kids that are older, between 15 and 20 years of age. You'll notice that every time that child ages between 15 and 20 in 2018, the rates are going to go up significantly. And so by the time we get to a 20-year-old last year versus this year, those rates will go up 52%. So what we're telling employers is that we have good news for you. Your rates from a carrier perspective only went up 5%. But when that boils down to that employee level, they are going to get crushed. And it's important for you to be able to understand this was done to avoid that big leap between a 20 and 21-year-old. But what it ended up doing was costing that employee a significant amount of additional money, and they're not going to understand what happened. So this is an attempt to explain it to them. If you have any questions on this, please let me know. But this is what's going to go on in 2018. And your rating folks are going to need to be able to explain this to the employees that are going to be impacted by it. eCentral is available. And again, anybody that needs access to that is available for free. We do the provider searches. We get it set up for you in 24 to 48 hours. We can either send you a template, you'll fill it out, send it back to us, we can set it up. We will do a conference call with you and the HR manager there to take them through the sequence to make sure everything is set up exactly right before it goes live. And we've had a lot of success with this. So please take advantage of this as well. And once we get it done, we do have, if it's in our quoting engine, we hit a button, it goes to eCentral, and then we have the ability to transition it over to the carrier. So a lot of ease in doing it this way. So we want to make sure, again, give it a try in 2018. That way, once you have an understanding of how it works, I think more of your groups will be accepting and open to get that done. Broker picks. As I mentioned at the beginning, one of our goals in 2018 is to increase the profitability to your agency. We know that the commissions are going down. One of the things you can do to offset this is take advantage. Any group we write with you, we'll put a premium only plan in place for the first year. We also, as I mentioned, any group we write with you will do an eCentral subsidy. So if it's a group of 30, we'll go ahead and give you $1.40 per head per month times 12. That is $540. That'll be a payment to your eCentral account. That money can be used to, again, do the 1095Cs or anything else you need, or it can offset your existing costs associated with that. The other discounts are listed here, and we also have preferred pricing with the vendors listed below. So please come to us to check with, if you're going to be setting up an HRA, let us know. We can send you the pricing that we have already pre-negotiated to save you money if your group needs that as well. The partner services are listed here. Education, which is what we're doing today. We have the sales support, the employer HR services. We have quoting specialists here that are on standby to help you. We have employer training, and we have the underwriting tools to make sure that whatever possible scenario you can come up with, if you have any questions on it, please give me a call. We can walk through it ahead of time to make sure that there's no surprises when that group gets implemented. We have a number of ways of staying connected through Twitter, YouTube, emails, LinkedIn, and SMS. Thank you so much for joining us this morning. That was a lot of information we covered. We are currently out of time. So what I will do is I will send you the information that was covered here in today's presentation. If you have any questions on any of it, please let me know. And we look forward to working with you in 2018. And again, our goal is to save you time and money, increase efficiency, and free up capacity at your offices. Thanks very much. Happy New Year. Bye-bye.